Welcome! Today we're going to be teaching you a bit about gastrostomy tubes, also known as G-tubes. As you may be aware, this is a G-tube, which you also may see referred to as a low-profile tube or a Mickey tube or a Mini 1 tube. These tubes all serve the same purpose, which is to allow access directly to the stomach without the need for a tube going through the nose or mouth. This allows a person to receive food and medications directly into their stomach if they are not able to swallow them. G-tubes such as these are surgically placed in the operating room with your child asleep under general anesthesia. The tube is held in place by a balloon that sits within the stomach. The button portion of the tube sits on top of the skin, most typically in the left upper part of the abdomen. Now let's talk about how to use the G-tube. Once the G-tube has been inserted, it should be connected when the child is due to receive feeds or medication. All feeds and medications should go through the extension tubing when given. Connecting the extension tubing can be done by aligning the black line of the G-tube with the black line of the connection tubing and locking it into place. The connection tubing is then turned clockwise as shown by the arrow in order to secure it in place. You are now ready to administer feeds or medications as instructed. When not in use, the G-tube should not be connected to the extension tubing. To disconnect the connection tubing, simply turn it counterclockwise and release it from the G-tube. The G-tube cover can then be replaced to close the G-tube. An important point to note is that there is a one-way valve inside of the G-tube, meaning that if you open the cover and feeds or stomach contents come out, the valve may be worn and the tube may need to be replaced. Ask your doctor if you are noticing this. Next, we'll talk about cleaning the G-tube and extension tubing. This can be done using soap and water and gently rubbing on the skin next to the G-tube. You do not want to cause irritation, so we advise you to be gentle, and you can use a soft cloth or Q-tips to do this. To clean the extension tubing, flush it with regular dish soap and water and hang it to dry. Some surgeons will leave dissolvable stitches underneath the skin next to the G-tube, which help to hold the stomach against the inside of the abdomen. This may cause some dimpling of the skin, which usually smooths out with time. There also may be some redness or irritation, which often improves on its own. If you notice spreading redness or pus draining, swelling, or your child is sensitive when touching the area surrounding the G-tube, please alert your doctor, as this could be a sign of infection and further care may be needed. G-tubes may cause granulation tissue, which is a red, beefy-looking scar tissue. If you notice this, bring your child in for timely, non-urgent evaluation. If a G-tube becomes dislodged, the hole into which it is going may close on its own. This can be problematic if it happens when the G-tube is still needed and the hole could close very quickly, especially in a relatively new G-tube. Although we will eventually teach you how to replace a G-tube and check for proper placement, before you have that skill, it is important that you carry your spare G-tube with you at all times and go right to an emergency room if your child's G-tube becomes dislodged. We hope that you found this video informational and that it helps you to better care for your child's new G-tube. If you have further questions or need any advice as it relates to G-tubes, please call our office at 954-265-0072. Thank you for allowing us to continue to care for you throughout this time. We're always here for you.